Hello, I'm Chris Kruger, Senior Manager for Content with the Davis Phinney Foundation, and I'm very pleased to be here to talk with Dr. Joohi Jimenez-Shahed about questionnaires and Parkinson's, and how My PDCARE, a questionnaire that's been developed by AbbVie Medical Affairs and a panel of movement disorder specialists, can help people with Parkinson's improve their quality of life and the quality of their visits with their care team. Before we get started, Dr. Jimenez-Shahed, can you maybe just explain to our audience a little bit about your background and how you came to be involved in Parkinson's?
Yeah, certainly. And thank you for inviting me to have this discussion with you today. So I am a movement disorder specialist. I have been treating patients with Parkinson's for about 20 years. A particular interest of mine is in the treatment of patients with deep brain stimulation. So that is the perspective from which I come at this particular topic today. But I also have a general movement disorders practice. I do clinical trials and treat a number of different patients with different types of movement disorders.
Yeah, so you mentioned the deep brain stimulation intersection here, and that's, I think, because My PDCARE, what we'll talk about in a little bit, is focused on these sort of decision-making moments where we have to think about what we might do in the next steps of our treatment.
Yeah, absolutely. And as I've told you before, my involvement in this project and working on the tool and talking about why it's useful for helping to manage Parkinson's patients stems out of the fact that I felt like there was really a strong need to be able to talk to patients directly and in a better way about the symptoms that they're experiencing. So we'll get into that, but I'll let you go on.
Yeah, thanks. So I said we a couple moments ago, or maybe I said our, and I just want to add real quickly that I was diagnosed with Parkinson's 5 years ago, and I was about 37 at the time. And I guess I bring that context to this conversation. And like many people who live with Parkinson's, I've taken a lot of questionnaires related to Parkinson's. So maybe to start this conversation, can you describe a kind of zoomed out view of where those of us living with Parkinson's might encounter questionnaires, surveys, and things of that nature?
Sure. I think sometimes just living on this earth and kind of being, a person subjects you to being asked a lot of different questions and surveys and questionnaires. So I'm sure people have encountered lots of different things. But particularly about Parkinson's disease and in the context of healthcare, we may like to use surveys in a number of different ways. And I think one of the most obvious ways that as a clinician and a researcher in Parkinson's disease that we use surveys and questionnaires is actually in that research context. And the reason for that is when you do a survey or a survey which may be more qualitative and just asking open-ended questions is actually different from maybe a questionnaire where there's specific questions with specific answers that are, tied to a particular implication. Those maybe are used to help measure the severity of symptoms that people are experiencing. That gives us both a sort of presence absence kind of idea, but then it also gives us an idea of severity. And a good example of this might be some questionnaires that are commonly used for assessment of depression or anxiety or other mental health types of questionnaires. We also use them. A common one in Parkinson's disease is actually the Movement Disorders Society Unified Parkinson's Disease Rating Scale, which probably everybody in some way, shape, or form has done components of. But there are a couple of sections of that are particularly question and answer based and answered from the perspective of the patient. So they really are truly patient-reported outcomes. And these give us very important details about the types of symptoms that people are experiencing, and again, sort of the severity of them, the extent to which these are affecting their day-to-day activities, et cetera. So a lot of that just for research and then also for clinical care. The other questionnaires that people may answer in the context of healthcare or a visit with their doctor may relate to particular symptoms that doctor knows that you are experiencing, maybe that they have a particular interest in trying to understand in their patients. Some of these may be, related to the primary condition. They may be related to other things. For example, in Parkinson's, we know that there are a number of different associated features, not just the motor features. So you might have questions about your sleep. You might have questions about mood, as we already talked about, maybe some things related to cognition. And so those can inform the doctor that you are seeing or the clinician that you're seeing about what is going on. And there's other ones that we may also use, such as the My PDCARE, that can allow patients to sort of think through their symptoms, maybe help them recognize the aspects that they need to call to the attention of their clinician. And then that really can be used in a way to help them prepare and to really even facilitate the conversation that they want to have with their clinician.
Yeah, thanks for that. You just described a lot of information about different types of surveys, and that's part of the reason I asked the question because there's just so much opportunity for people with Parkinson's to encounter this subject, and sometimes it can be difficult because
Yeah.
there's a lot of information you're asked to remember, and all these things can get a little bit muddy. But I wonder if maybe you can, since you just described a lot of different types of places and circumstances in which we'd encounter these kinds of questionnaires and surveys, I wonder if maybe you can sort of say again, or maybe say in a new way, why these things are useful for those of us living with Parkinson's and what we should keep in mind as we prepare to use them.
Yeah, I think, that in my practice, for example, when we have patients coming in for the first time, we've never seen them before, and we're just trying to get a better sense of where they are in their disease and what are the problems that they're experiencing. That really gives us a good structure from which to kind of identify, okay, these are some of the key problems, and we need to dig into those a little bit more deeper. It also allows us a baseline to say that, okay, when I first saw this patient, this is how they were doing. And perhaps down the road, maybe I change a treatment, maybe I start a treatment specifically for a problem that I realized was occurring because of an answer to a questionnaire. And then we can look back later, repeat the questions, and see whether there's been the intended improvement or not. So it gives us really that point of being able to track symptoms. And I think that can be very useful, certainly in my practice, and we've done that on a number of occasions. Questionnaires can be sort of, I don't want to say structured, but kind of organized maybe in different ways. Some of these, the more formal ones that are looking at particular symptoms like the UPDRS or maybe the depression and anxiety scales, MoCA, which looks at cognitive functions. These are often quite extensively studied and validated. So we know that they're giving us important information that really hones in on the problems that people with Parkinson's are experiencing. Other, surveys or questionnaires like how was your appointment today? How was our service? Those may be a little bit less validated and maybe just looking for some open-ended kind of what we call qualitative information that may also be informative in different ways. So they, may be interpreted a little bit differently, but they don't really give you those sort of comparative points. I think, the other part of this that maybe I wanted to comment on is that, a lot of times when we're talking about Parkinson's treatments in particular, we're focused on this is going to improve your symptoms by X amount. This is going to extend the duration of your medication by a certain amount because that's the way they were studied. That's the data that we have about the way that these medications work. But I think increasingly we're recognizing the importance of what we call patient-reported outcomes, PROs. And PROs are used extensively in research, but they can also be used in this manner as well. And what it's nice about it is that we are trying at least to give the patient the opportunity to give us more information. And I think that's obviously, that's why we're here. That's why we're trying to, what we're trying to accomplish is to help the patient with their symptoms. So having that patient-reported aspect of things is often a lot more informative than just the routine clinical examination and tasks that we can do. And then lastly, everybody's pressed for time, right? I mean, we've got these short appointments. There's a lot of information that we want to share or that we should be able to, at least have a conversation about. And so maybe this allows us to really hone in again on some of the issues that are perhaps more prevalent or more bothersome to individuals.
So we started pretty zoomed out and talked very broadly about questionnaires and surveys that we encounter when navigating Parkinson's. But you chose to be a part of the development of this My PDCARE tool, so you have a perspective about this. And I'm wondering if you can maybe dive in a little bit, if we can go there now and just talk can you describe My PDCARE, what makes it different, and how someone living with Parkinson's would use it and how it might help them improve their care? There's a couple questions there, but if you can just dive in and give us some more information about this in particular, that'd be great.
Sure. So, as I mentioned earlier, I became involved in this because I felt like asking questions the patient, or sorry, asking patients the questions in sort of a particular way. This is what I do, generally speaking, in practice, but to maybe formalize that a little bit more and see if there's a way to give others the opportunity to have these maybe more focused conversations on symptoms. And what we're really talking about here for My PD Care is looking at sort of a level of symptom control. Okay, so it was really designed for people who are already taking levodopa, and that questionnaire gets at some specific things about how well the levodopa is working, how long the effects of the levodopa last, whether there's dyskinesias, how often in a day a person is needing to take their levodopa. And these are often the questions that we use to really try to understand, okay, this person's doing pretty well on their current regimen because when they take their medicine, it kicks in, they're functioning very well, it doesn't really wear off, and they're not having dyskinesias, and so maybe things are okay from the standpoint of the motor functioning. By contrast, maybe we start finding out, okay, well, this person is taking their meds every 5 or 6 hours, but the best effect is really only lasting 3 or 4 hours. So now what do we need to do? Do we need to make an adjustment to that medication? And the answer may be different depending on how bad the wearing off effects are. But you either really have to be sort of very knowledgeable about how to ask those questions, or you could use a tool like this, or a patient could answer a tool like this to really kind of readily give the answers. It takes less than 5 minutes to complete. It's pretty easy to do. It can be done in an online form, or there's a paper version that can also be done. I will tell you, in our office, we actually send it out ahead of the office visit to our patients so that we get the answers and can look over them as we're seeing the patient and sort of get a quick bird's eye view of what's going on and where this person might fall in their treatment, or just in their Parkinson's kind of course, right? Because we know that things change over time. So I think that that's primarily the way that we've been using it as sort of a pre-appointment sort of questionnaire. I think, other ways that it could be used, as we were talking about earlier, were to maybe repeat that every so often just to sort of see, okay, at this point in time, a person was having these types of problems. They were or were not having dyskinesia, but now, a little time has passed and these are the things that have changed. So I think those are ways that it can be helpful and informative, hopefully both for patients, but as well also for the clinicians that are taking care of them so that they're getting some of this important information.
Yeah, that's what I was going to ask you actually was what's the utility for you as you're providing care for people? How can somebody complete this in a way that gets you more information to help them better? What can we do to make this more useful for you if we're going to complete these surveys or use My PD Care?
Yeah, I think, well, the options are that, as I mentioned, you've got the online version. If you do the online version, you can print it out and bring it into the office. You could send it to your doctor, actually, if you know their email address. So lots of different ways to sort of have it and kind of keep track, or like at least have it become a part of your medical record, and to make sure that your clinician gets to see it. So I think those are, that's a very, kind of useful way. I think patients often come to my office with their list of questions, right? And so, after I've done all the stuff that I need to do to kind of make sure that I've got the information, then I always give the patient the opportunity to say, okay, well, what are the questions that you have? What have you been reading? Where can we provide more information? And I think if, a patient were in sort of the position of visiting with a doctor and maybe didn't get a chance to answer these kinds of questions, you could certainly say, well, I was looking through this questionnaire and I answered, these kinds of questions. Do you think there's something that needs to be done differently with my medications? Or I realize I'm having this problem. Is there a way that we can address that? So I think it can really, be a way to sort of facilitate some of the conversations that maybe need to be had about the level of control that people are experiencing. And if the clinician has already asked you those questions, great. If they haven't, then you've got the opportunity to kind of bring that up, and you've got sort of a ready report, in a way that can help you. And maybe also sometimes it's hard when the clinician is asking you, and all of a sudden you're trying to think, okay, what is it like? And maybe if you give yourself some time ahead of time to think about those questions, then you've got some prepared answers.
Yeah, you just said something that made me consider another way that I might find this useful is that if I went to my appointments with this filled out, that would maybe free the time for conversation to talk about the things that I'm wondering about that aren't necessarily sort of they don't fall into the category of how effective is my treatment and the sort of questions that are asked on the My PDCARE survey, which are sort of data driven in a certain way. They're not exclusively, as far as I can recall from when looking at the survey, but they're not the questions like I read this research article, what do you think about it? That's a great bigger thing to talk about. And so if I went in with this survey completed, that solves a lot of problems. There's a lot less for us to talk about because my provider can look at
Questions
this
can
and
be asked.
see,
Yeah.
here's what's going on, here's the picture.
Yeah. No, I think it can certainly go both ways, right? One, there could be, an opportunity to, really talk about some of the stuff that needs to be changed. But by, contrast, if things are going pretty well, this can be just sort of confirmation of that. And absolutely, that may free up the conversation for other things as well. So that's definitely a good point.
So let me try to just summarize this and make sure I got this right. As I understand it, the MyPDCare tool is something that can be used for a variety of purposes, but it's a short survey I can complete online, or I could print it out and bring it to my appointments and filled out by hand. And one of the things that this is useful for is maybe helping to inform myself and my provider about what's going on with my treatment and how the treatment may evolve, or the next steps we might pursue, or what might come next for my care. And is that an adequate summary? What am I missing?
Yeah, no, I think that's absolutely it. And, I guess maybe the part that I didn't mention earlier is that there actually is a corresponding clinician tool. So if the clinician, sees that there are some of these things, there's actually a longer sort of version for the clinician to fill out. That one's called Manage PD. And what that questionnaire does, it's for the doctor to fill out after they've seen the patient or maybe during the visit, but it actually goes into more depth on some of these questions. And the output from that particular questionnaire is interesting because I think it's the first scale to sort of really do this, which then sort of summarizes the situation for that individual patient. Okay, this person answered all these questions this way, and that actually means that their Parkinson's symptoms are probably pretty well controlled. This person answered the questions this way, and based on these answers, it suggests that perhaps a medication change needs to be made, or the patient could benefit from a medication adjustment. And then the third, kind of category that managed PD tool comes out with is perhaps this person is appropriate for a referral for an advanced therapy. And the advanced therapies are things like the levodopa pumps. Now we have the apomorphine pump, and also deep brain stimulation, or maybe even focused ultrasound. So all of these different sort of therapies that we consider when people are experiencing problems with the way that their symptoms are controlled, this can kind of give us a clue, the use of this My PDCARE, and then maybe even subsequently digging deeper, either just through further questions or through the other specific tool for the clinician, the Managed PD tool, to really kind of categorize the direction, as you were saying, that the care or next step perhaps that would be appropriate for this particular patient. So I think that it was designed to be able to sort of lead to that. And I think when put together, certainly I think can help us really identify where we have the opportunity to make important interventions for our patients.
Great. Well, thanks for taking some time to walk me through this and walk our audience through this. And I would encourage our audience to take a look at the tool because it's maybe something you want to incorporate into your preparation for your visits. And we'll put a link to that tool at the website in our description of this video. So you can find that in the description. And yeah, I guess before we wrap up, I just wonder if there's anything else that you think a person living with Parkinson's might want to know about related to this tool, or if there's anything else you think you might want to share with us that might help us get a better outcome from our visits.
Yeah, the first thing I was going to say in response to your question, Chris, was just that I think we're starting to see a lot more treatment options available for the time when people are experiencing some of these issues. And these issues are things like the fluctuations, the dyskinesias, and how challenging that can be to control with just medication. So the fact that we have more therapies available, I think is helpful. And I think, the challenge is always getting the information out there to patients about whether they are candidates, and if they are candidates, getting them to somebody who can actually implement that therapy for them. So I think it can be, it can be useful, especially so in sort of our present time, because we're starting to sort of see these new therapies coming. And I think it's also just, kind of really easy to do. And even if it's just something you kind of assess and sort of take stock of your own symptoms and just try to, keep track of it on your own that way, I think that can also be informative, because like I said, these are the questions that we're asking in order to help make the decisions about the treatment. So hopefully that helps.
Yeah, thank you. I do think this is a potentially really useful tool for me personally, and so I'm grateful for having you explain the background of it for me. And I hope our audience finds it valuable too. I'm sure that if they look at it, they will see the utility that they can get from it in terms of preparing for their visits, and hopefully it'll result in better treatment and more controlled symptoms for people living with Parkinson's. So thank you very much for your time.
Yeah, thank you. I appreciate it.